As of today, we have a total of 142 laboratory confirmed cases connected to this outbreak and 26 hospitalizations, 25 at the Alberta Children's Hospital and one at the Peter Lougheed Centre. There have been 5 patients associated with this outbreak who have been discharged since the outbreak was declared. The majority of individuals who get sick from E. coli generally improve on their own and without specific treatment within 10 days, but a small proportion may develop more severe complications. Currently, 11 of those hospitalized children have more serious illness related to this outbreak, and our hospitals have the equipment required to establish patients receive the best care possible. A small number of patients are receiving peritoneal dialysis. However, this number is too small to provide for privacy reasons. At this time, all children on inpatient units are stable. Facilities will only reopen if we are confident that health and safety will not be affected. Currently, there are 11 facilities which have been issued closure orders last weekend. 4 of those sites have not had anyone reporting E. coli diagnoses or symptoms. These 4 sites include Fueling Brains Bridgeland, Little Oak Early Education, Almond Branch, and Brainier Academy. These 4 facilities may open Monday, September 11th, as long as there are no cases or kid staff reporting symptoms. No stool samples are required for attendees and staff at that site. The other 7 facilities where there have been affected children and staff have an additional exclusion order. The exclusion order means that these children and staff may not attend any childcare facility. These 7 facilities will be permitted to reopen Tuesday, September 12th. However, children and staff will require clearance from Alberta Health Services. We call this a rescind letter to attend this or any other childcare facility. And this is in order to prevent any further transmission of infection. We continue to be working off the hypothesis that it is a central source linked to this kitchen. And with that, the rate that we've seen these new cases is what we would expect. It's in keeping with a point source, so single source of infection. And so we do anticipate that our case numbers will stabilize as we move into the weekend and next week. Our main focus with all of our stool testing and these rigorous measures we have in place is to monitor if we're seeing any secondary spread. I can say to date, we have not seen any cases linked to this outside of households of perhaps sick contacts. So we have not seen it in any other daycare facilities, other food handlers, other places in the community.